A 60-year-old man in Germany has become at least the seventh person reported to be free of HIV after undergoing a stem cell transplant. Remarkably, this man, who has been virus-free for nearly 6 years, is only the second person to receive stem cells that are not specifically resistant to the virus. Dr. Ravindra Gupta: I am quite surprised that it worked. It's a big deal. Timothy Ray Brown, known as the Berlin patient, was the first person to be declared HIV-free following a bone marrow transplant to treat blood cancer. Brown and a few others received special donor stem cells carrying a mutation in the CCR5 gene, a receptor used by most HIV strains to enter immune cells. Many scientists believed these cases indicated that CCR5 was the key target for an HIV cure. The latest case, presented at the 25th International AIDS Conference in Munich, Germany, challenges this notion. The patient, referred to as the next Berlin patient, received stem cells from a donor with only one copy of the mutated CCR5 gene, meaning their cells express CCR5 but at lower levels than usual. Sharon Lewin was interviewed saying, "This case suggests that curing HIV is not all about CCR5. The findings expand the potential donor pool for stem cell transplants, a risky procedure typically reserved for people with leukemia and unlikely to be used widely for individuals with HIV. About 1% of people of European descent have mutations in both copies of the CCR5 gene, while around 10% have one mutated copy." Dr. Sarah Weibel explained, "The case broadens the horizon of what might be possible for treating HIV. Globally, approximately 40 million people live with HIV. The next Berlin patient was diagnosed with HIV in 2009 and developed acute myeloid leukemia in 2015. Unable to find a matching stem cell donor with mutations in both copies of the CCR5 gene, doctors found a female donor with one mutated copy, similar to the patient. The patient received the stem cell transplant in 2015. Christian Gabler said the following: "The cancer treatment went very well. Within a month, the patient's bone marrow stem cells were replaced with the donors. The patient stopped taking antiretroviral drugs in 2018, and nearly 6 years later, researchers find no evidence of HIV replication in his body." Previous attempts to transplant stem cells from donors with regular CCR5 genes have seen the virus reappear weeks to months after stopping antiretroviral therapy, except in one other case. In 2023, Asier Sirion from the Pasteur Institute in Paris reported on the Geneva patient, who remained free of the virus 32 months after stopping antiretroviral therapy. Researchers are investigating why these two transplants succeeded when others failed. They suggest several mechanisms. Antiretroviral treatment reduces the virus level significantly. Chemotherapy kills many of the host's immune cells where residual HIV hides, and the transplanted donor cells might attack and destroy remaining host cells harboring the virus. The rapid and complete replacement of the host's bone marrow stem cells with those from the donor may also play a crucial role. If you can shrink the reservoir enough, you can cure people. The presence of one CCR5 gene mutation in both the next Berlin patient and the donor might have created an additional barrier to HIV entering cells. This case has implications for early-stage clinical trials involving gene editing techniques like CRISPR-Cas9, which aim to remove the CCR5 receptor from a person's cells. Even if these therapies don't reach every cell, they could still make a significant impact. Together, we continue to advance in the fight against HIV. Please subscribe to our channel for more updates on groundbreaking medical advancements.